Hi, I'm Leah Todd, and you're listening to None of Us Are Normal. You can't see me right now because this is a podcast, but if you could, you'd see me putting emphatic air quotes around the word normal. Honestly, what does it mean to be normal anyway? Who decides what is or isn't normal for each of us, and why do we all so desperately want to be normal? If you don't know me yet, I'm a Canadian country artist living in Nashville, Tennessee. I'm a wife, a frequenter of my sunroom, a dog mom of two, and as of recently, a podcast host. In my experience as all of these things, I've decided that none of us are normal and that normal is something completely made up that puts limitations around our feelings and experiences. But here's something that's not made up. We all struggle. We all experience sadness sometimes, whether momentary or all-encompassing. We all deserve joy in our lives. No, none of us are air quotes normal, but we're all very, very real. Join me in real conversations with real people who I know and love to discuss mental health, music, and what it means to make the most out of life. These conversations will be equal parts tough and fun. As in anything in life, there are two sides to every coin. I'm happy that you're here, and I hope you enjoy this episode of None of Us Are Normal. This podcast is not intended to be a substitute for professional advice, diagnosis, or treatment. It is in no way medical advice. For 24/7 free and confidential support, referral, and treatment options and guidance, please call the National Suicide and Crisis Prevention Hotline at 988. If this is an emergency and you are in an immediate danger to yourself or others, please push pause on this episode and immediately call 911. Hey friends, I am so excited and honored to have my very own sister today as a guest. My sister is a psychologist and she is a wonderful person, and I cannot wait for you guys to hear what she has to say about grief, dealing with grief around the holidays, how to get through the holidays, how to find a therapist, and all things about therapy. I'm really excited for you guys to get into this episode, and please stick around for the end for the pick-me-up because it is so awesome.
Thank you for having me. It's a pleasure to be here. Yeah, so I am a clinical forensic psychologist. I practice in Ontario in Canada. A little bit about me. I went to grad school in Chicago. Loved Chicago. It's one of my favorite places ever to visit, and I have a lot of friends there, a lot of great memories there. But came back to Ontario, back home, settled in Kingston. And it's in Kingston where I began working in the prison system. I did do a little bit of prison work in the States as well, but that was when I was training. So did a lot of work here in the institutions. And then in 2019, I transitioned into private practice. So now I work with clients in the community here in Kingston, and the practice is actually growing to a group practice. So starting to bring on therapists and build a really great team.
That's awesome. As a sister, I'm very proud of you.
Thank you.
Yes, I remember the days of being in Chicago. Still, my absolute favorite burger place of all time is DMK Burgers in Chicago. And whenever I'm performing and somebody tells me that they're from Chicago, I make sure to mention that that's my favorite burger place. So Chicago was definitely a huge part of both of our lives. So Leah, let's just kind of get right into it. What is therapy all about? Because I feel like there are a lot of people out there that might be perhaps afraid to, look for a therapist or feel some sort of shame around, mental health issues. And I'm so over that whole sort of mindset. And so can you explain exactly, what did you, I mean, I was gonna say, what did you learn? But I guess you went to school for like 10 years, but what is therapy all about, and how can we make people feel more comfortable?
So that's a really big question because I think therapy looks different for different people and with different therapists. there's a lot of different approaches to therapy. So it really is important to find a therapist that you feel comfortable with, who has experience dealing with the presenting issue that you're coming in with, and really to ensure that it's a good match between you and the therapist. But in general, when I first meet a client, the sort of initial sessions really involve gathering information about the client, about why they're seeking services. So what is it that brought them into therapy? What are they hoping to get out of therapy? How would their life look different if at the end of it they said, therapy really worked for me? So we're really sort of defining goals in the beginning, and establishing a relationship. So again, it's really important that the person feels safe and comfortable, and accepted in the space between us. And then, depending on whatever the presenting issue is, we collaborate on a treatment plan. So I would sort of offer my conceptualization or what I think the client would really benefit from. So, first of all, what is the problem? Why do we think that problem exists for that person? How did they get here? And how's that problem being maintained through maybe behavior that that person is engaged in, or specific patterns of thinking that that person is engaged in? And then finding points of intervention. So, what can we do to start to interrupt those patterns and replace it with something that's just a little bit healthier and a little bit more aligned with what they want their life to look like and what their goals are for the future? And there's a lot of different treatment modalities. So it really depends on what the reason for therapy is. But that is really the foundation for therapeutic work, I would say.
I love that. I love that because it's so accepting on every level. Like I hear when you're speaking, I hear zero judgment, and I think that's really really great. And I've always I mean, I know I'm your sister and it's a little bit biased, but I've always thought that about you, and I always thought that was really cool. I even remember back when you were in University of Guelph and just like learning, your undergrad, I guess it was, and you talking to my high school friends that were going through breakups. And you were like you really cared about them. And so I feel like that is something that I hope people take away from this conversation, because when you're looking for a therapist or a counselor or a psychologist, anybody that is, able to help you, that they're there because they want to be there and they want to help. And I think that that's just kind of an important message to get across. I think you did just with your explanation about why you do this.
Absolutely. And I think what a lot of people don't realize or don't know or maybe don't think about is that it is a real human connection in the room. It's not just this, client and professional, and there's sort of this imbalance in power. It's really when I'm meeting with a client, we really have a human connection. And I often walk away from my sessions feeling energized because I'm inspired by the work that people are doing, the hard work that people are doing in session, and sort of the willingness to go to really vulnerable places. And I really don't take that lightly. It's an honor to be on this journey with a client. And I'm changed because of my clients. So in really good ways, I learn from them just as much as they might be learning from me. So it really is a collaborative experience.
I love that so much. I actually remember you saying that to me once, and I thought that was really cool because you did your final session with one of your clients, and this was like a long time ago, and you just said that you walked out of it and you felt like so proud of the work that you two had done together, and you felt so good about what their future might be, and you were really excited for them and you were really happy for them. And you said like that sometimes you almost not like mourn your client, but you were like, oh, I'm going to miss them, and but you're also like really happy that they were like moving on to a bigger part of life and you felt like you guys had some good work together.
Of course. Yep. Every single client that I work with leaves an impression on me and I have a memory for. And, just as, their experience in therapy might be really impactful, it is for me as well. I remember bits and pieces of it and I sort of carry all of my clients with me. I think it makes me, grow as a clinician, but then also as a person. So, and these are conversations that we have in session. Like I speak with my clients about, how I felt in session today and how inspired I felt by the work that they were doing, or, how frustrating it was today, sort of for both of us. And, it's just a really raw, transparent interaction.
I am just so happy that you're on here because I feel like it's really an important thing for people to hear straight from a psychologist what you're thinking and how you feel about it, because I feel like I said previously, I just feel like a lot of people feel that they may be judged or that there's a stigma around it. Yeah, I feel like a lot of people have this sort of idea that you have to have something wrong with you in order to go to therapy. And a lot of people might not go to therapy until something's wrong. But I know that there's a lot of therapists, and I think I've heard you say it before, that you think everyone should have therapy no matter what area they are in their life or what kind of spot they are in their life, whether they're in a really great spot or in a not so great spot. You think that therapy would be useful for everyone. Is there a reason why you think that it's good for people who are just kind of feeling all right?
Absolutely. Therapy can benefit everyone. I think that none of us escape life without pain. Pain is just part of life and it happens and it will happen to every single one of us. It's part of life. And sometimes people need a little bit of extra support to move through that pain and sort of, move forward from pain and heal from pain, so that, suffering doesn't occur, right? There's a difference between pain and suffering. We all experience pain, we all experience loss. These are just sort of inevitable aspects of the human condition. But just because we experience pain does not mean that we have to experience suffering. Suffering is prolonged pain. It is really sort of when we get stuck in pain and it lasts a long time. And so I believe that everybody can use some help moving through pain. And even if there isn't pain, we can all benefit from personal growth. I mean, none of us are perfect. And perfection's not even the goal, but there's always room to feel better or to, move towards a goal that we might have that we might be struggling to achieve or accomplish. Um, we can all grow in different ways, in relationships, in our occupation, in the way that we take care of ourselves, the way that we talk to ourselves. We can always become better versions of ourselves, and therapy can really help somebody support them in that. And then, of course, therapy can be helpful for people who struggle with mental illness as well. And there is a difference, right? There is a difference when someone is struggling with mental illness as opposed to somebody who's struggling with the inevitable pain of life. I mean, mental illness, psychological disorders, there are certain criteria that would have to be met and fulfilled to be able to receive a diagnosis. But there has to be a significant level of psychological distress associated with those symptoms or the collection of symptoms that a person's coming in with. And there has to be some kind of functional impairment. So these symptoms are causing such significant distress, and they're also preventing the person from functioning in various ways. So, impairing their ability to work, impairing their ability to relate to other people in healthy and effective ways, impairing their ability to take care of themselves, shower, make sure there's groceries in the house, pay bills. So that's sort of at the other end of the spectrum.
So I think what you were differentiating between is regular everyday life and then people who struggle with mental illness. And there's also situational things, right? That's what you were kind of discussing. So, like, for example, the loss of a loved one or a breakup or, the loss of a job or whatever it is, right?
hmm But I think to summarize, everybody can benefit, right? There's a reason for therapy if you look hard enough. Um, and sometimes you don't have to look all that hard. We all know what we struggle with, right? We all are able to sort of identify things in our lives that are not flowing with ease, right? Or there's tension or there's conflict. And um, yeah, so we can probably always look for a reason to improve, and therapy can just help people do that.
So, I want to talk a little bit about grief and that sort of thing. But first, I'd like to just ask you, how should somebody go about finding a therapist or a counselor or like somebody to talk to? What are kind of the steps? What should they look for? Should they be researching the different types of therapy, or should they just be looking for a connection? What are some tips and pointers, I guess, for finding?
Yeah, you know what? That's a difficult question to answer. And what that tells me is that it's a daunting task for people um, to try to find a therapist that would suit their needs and that they would feel comfortable with. Um, the training and the qualifications that are necessary to receive certification or licensing or registration really differs depending on where the client is from. So in the States, it's state by state. There's different requirements, training requirements to become registered with the board or the college, and the same in Canada. So it's sort of hard for me to say exactly what to look for in terms of licensing because it really depends on where the client is. But you do want somebody who has at least a master's degree in psychology and counseling psychology or clinical psychology, somebody who's had some supervision as part of their training. Um, and then, as you know, Psychology Today is a really great tool. It's an online platform where many clients, or sorry, psychologists and psychotherapists and therapists register. And so if you go onto Psychology Today, they've got lots of different filters where you can sort of filter out what you're searching for by presenting problem, by area, by modality, if you're familiar with the therapeutic approach. And then you can just start there by reading some bios and looking at a picture too. Um, at the end of the day, the most important element is rapport with your therapist. You really have to feel a connection with the person that you're seeking services from. You and you know that doesn't happen right off the bat. So it does take some time to develop trust and to develop a certain level of comfort, but there has to be some initial sort of attraction to that therapist. Maybe it's just the language that they use or the tone of their voice that feels inviting and warm and comforting, or maybe it's about their experience. So maybe you're coming in with depression and you know that this person has a lot of experience dealing with clients who have depression and struggle with the same sorts of problems, um, and giving it a chance to, right? So the first session and the second session, sometimes even the third session, is just about building that relationship and being able to have an open dialogue as well with the therapist. So if you feel like there's something that just doesn't fit right or just doesn't feel right, I would always encourage you before you cancel your next session or look for another therapist to bring it up in therapy. and practice sort of that assertiveness, or practice bringing forth a problem that you have, to give yourself an opportunity to work through it with somebody who's trained and skilled in that way. And then if there's a way to sort of, you know, address the issue that you have or the discomfort that you have with that therapist, I can promise you it's probably going to develop into an even deeper relationship with that therapist, because you've already worked through something together collaboratively. But if it's not something that is easily fixable, or it still isn't jiving, then looking for somebody else and maybe requesting a referral elsewhere.
Yeah, I feel like a lot of people kind of do that, where they go to maybe one session and they
Hmm.
feel like, oh, therapy doesn't work for me. And I feel like it's the same with anything. You just got to give it give it a bit of a shot, and if it doesn't work, to just keep trying, because there's got to be a therapist or a psychologist or somebody out there.
Yeah, you know what? That's so true. There's so many things that would be so obvious, right? Like going to the gym once and then saying going to the gym doesn't work for me. Well, you haven't given it enough of a chance, right?
Yeah,
And it's not just about the gym that you're going to, right? It's not just about the gym that you're going to, but it's about the effort that you're putting forth when you're at the gym too. And in between, workout sessions. So just like therapy, it is about finding a good match with a therapist, but it's also about how much you're willing to do the work, because the progress is going to depend on that.
that is so cool. I never thought of that before.
Look, all we can change are ourselves, right? We can't change anything about anybody else around us. And sometimes we can problem solve conflicts, or we can problem solve sort of external things that are happening in our lives. But at the end of the day, in therapy, the only thing that the therapist can help you with is how to change parts of yourself. So, changing the way that you cope with conflict, or changing your perspective around a particular issue, and being accountable when you're not putting in the work, and sort of recognizing, yeah, I know that we talked about that last week, and then a whole week went by and I didn't apply anything, or I didn't think about it again. Um, and then sort of finding, okay, well, what are the barriers to implementing some of the things that we talk about in session outside of session. So it's about being responsible for your own wellness, taking accountability for your own psychological well-being, and putting in the work, really being willing to try something different and new outside of session as well.
So this might be a loaded question. I don't know if this will be too big of a question or not. But can you explain to us the difference between, well, there's
Hmm.
psychology and psychiatry, and then there's also
Yeah.
psychotherapy, therapy, counseling. What are kind of the differences between all of those? Because there's a lot of words, and I feel like it might be hard for somebody to find who they're supposed to go to if they don't even know what
Hmm.
kind of doctor to look for.
Okay, so the first one that you mentioned is the difference between a psychiatrist and a psychologist. That is a very big difference. A psychiatrist is a medical doctor. They have prescribing privileges. So they typically work from a medical model, and they are able to prescribe medication to treat the symptoms that people are coming in with. They can diagnose as well, um, but the modality of treatment is often medication. If you can find a psychiatrist who also integrates therapy, or has some training in therapy, that would be a really great uh, combination. But in general, a psychiatrist prescribes medication. The meetings are much shorter, maybe 15, 20 minutes, half an hour per session. And then it's really about med management. So managing things like, side effects and the extent to which the medication is having an impact on symptoms. In contrast, a psychologist is not a medical doctor. A doctoral level psychologist has extensive training in clinical psychology, and sometimes other areas of psychology as well. So, for instance, myself, I'm also trained in forensic psychology, but overall, the objective is to be able to assess a person's psychological functioning, provide a diagnosis if one is relevant, and if the client wants the diagnosis or needs the diagnosis for any purpose, and to treat not just the symptoms, but the person and how those symptoms are impacting their day-to-day lives. So their relationships and their ability to work and, the way that they feel about themselves. And it's all through therapy. Um, Now, there's more subtle differences between the levels of, a doctoral level psychologist, a master's level psychologist, and it also depends on where the client is located, right? Because there's different terms in different locations. But sort of, the other category that you were talking about was counselor, psychotherapist, therapist. And in general, those professionals are not able to diagnose. They don't have the training in assessment and diagnosis. They're familiar with the various disorders, but are not able to provide a diagnosis. So what they do is they will still collect information about symptomology and presenting concerns, and then they would treat with therapy.
I don't know that I knew all that. So that's learning something new every day. Now it's time for your pick-me-up of the day, a quick piece of advice to help you through hard times.
Okay, so I'm going to do a really brief mindfulness practice with you that pairs mindfulness with breathing. And it's a really good exercise to do to help you transition. For instance, at the end of the day when you're leaving work, maybe just for a few minutes in your car before you go home, or maybe it's at the end of the day when you're just falling into bed. But this is something that can really sort of help clear out whatever it was that you were just doing and then move forward to the next part of your day. So what I'm going to ask you to do, if you feel comfortable, is just go ahead and close your eyes. If that doesn't feel safe or comfortable to you, I'll just ask that you rest your gaze in front of you. So maybe in your lap, or maybe just on the floor in the distance. And just take a moment to turn your attention inward. Just noticing how you're feeling in your body. Sort of settling into your chair. And then tuning into your breathing. So just watching your breath come and go as it does naturally. So there's no need to change it. Doesn't require any effort at all. Just sort of noticing your in-breath as it comes and your out-breath as it leaves. So again, just watching your inhale fill you up and notice your exhale. The first thing I want you to think of is a word that represents something that you would like to release right now, something that you would just like to let go of. So for some people, that word might be stress, it might be tension, could be a feeling like anger or frustration, worry. But whatever it is, I just want you to hold in mind the word that you would like to let go of. And when your next exhale comes around, I want you to pair that word with your exhale. So you'll take a nice deep breath in, and then you'll exhale, saying the word inside your mind, releasing that word with your exhale. Every time an exhale comes around, you're releasing that word, letting that word sort of ride your exhale right out of your body. Almost visualizing yourself making room inside your body as you release that tension or that worry or that anger, creating space. And now I'd like you to think of a word that represents something you would like to invite in. So for some people, that might be peace, could be relaxation or comfort, confidence, love, self-acceptance, self-compassion, something you think you could use just a little bit more of right now. Once you have that word in your mind, on your next inhale, I want you to bring that word in, using your in-breath to really invite that word into the space that you've created. Now putting it all together. So on your exhale, release. And on your inhale, invite in. Release and invite in. Allowing the breath to come and go naturally, but still pairing it with those words. So you're releasing and you're inviting in. And I'll let you just take maybe another 2 or 3 cycles of breath, pairing those words with your breath. And you can slowly begin to let go of those words and the things that those words represent. Just continuing to pay attention to the in-breath and the out-breath. So you're just letting it come naturally. There's nothing left to do, just watching the breath come and go. And when you feel good and ready, you can maybe invite some movement back into your body. Wiggle your fingers, wiggle your toes, maybe, tilt your head side to side. Stretch if you need to change your posture. Really just sort of inviting a little bit of energy back into your body. Once you've done that, the next step is to sort of invite your body back to the space that we share, back to the room, so you can go ahead and open your eyes, take a look around, and feel ready to step into the next part of your day.
Thank you for listening to None of Us Are Normal. Being a human is hard, and I hope hearing from other humans on my show helps you in your own experience. For additional resources or to learn more about today's guest, please visit DanielleToddMusic.com.
So make it worth every joy, worth every pain. Look for the sun even when it rains, and hey, we're all trying.